Alright, I wanted to detail how we make the sphenopalatine ganglion block kit. This is for patient use at home. The hard part will be getting off this child-proof seal. And having scissors handy may be helpful. Alright, I've got my prep done, so I'll be starting the video with an edit from here. Hi there, I'm going to start looking at the sphenopalatine ganglion kit. This is for patients to do at home with some teaching in the office ahead of time. A lot of times patients will come in, they'll get this done 2 or 3 times, they'll learn how to do it in the office, they'll go home and family or the patient themselves can perform this as a treatment for either trigeminal neuralgia or for migraines. The supplies include a viscous lidocaine topical 2% solution. I have a Braun extension set. It is a 1 ml priming volume IV extension set with lure lock, male and female at both ends. And we actually prepare that by cutting off the female side of the lure lock right at the base. I'll use 2 5cc syringes and sterile cotton-tipped applicators, not Q-tips. A Q-tip is not long enough to reach the posterior nasopharynx. The first thing to do is get the patient pre-anesthetized. Pull the syringe apart and put in 2 or 3 C's of viscous lidocaine. Cover the cap or the lure lock end, otherwise it will drip everywhere. And it's always nice to save the wrappers because you have to invert it and put the plunger back in without applying pressure, otherwise you'll squirt it all out the end. Let the lidocaine drip back down, and then you can add some pressure and get it back in a position without making much of a mess. This one is prepped. It's got 4 cc's of lidocaine. That's plenty. Same thing with number 2, and this one will be the therapeutic syringe. Same exact volume, same exact medicine. Invert so the lidocaine doesn't squirt out the lure lock end. And then once it's away from the lure lock end, you can gently pop it into place, because if you push too hard, you'll see it just squirts out like that. So it can be a little messy. These are 5cc syringes, and this is sterile cotton-tipped applicators. We'll take our lure lock, and there's our male connector, and we will insert this pretty much all the way in as a whole unit, or if need be, if it won't go all the way in, like in this one, just a little bit far from the end, you can jam it in so it's in the lure lock, or fine to do, just break off about 1 inch. Then take off any little loose pieces, because we don't want to accidentally inject that into the nasopharynx. From here, we will prime it. Fix it onto the syringe and just hold, or if it's for someone else's nose, don't hold the end. And you'll see that the injectate will come right out the end. And I will hold down. With too much pressure, you will see you can shoot your cotton tip applicator out. Or just like this, if it's being seen, you'll see the lidocaine only come out the end. An older version of this technique was lidocaine just dipped onto the cotton tip applicator, and you would get only that much. No way enough to get a therapeutic dose of between 2 and 4 cc's. There we go. I have a nice amount on the end. What I would recommend is, if you're doing this with patients, just wear a pair of gloves. And since it's for me, I'm just going to goo it up and lubricate the end with the lidocaine so it slides down easy. And now we are essentially ready to go. The step that I did not perform initially is, while you are preparing the catheter and sterile tip applicator, you'll have the patient with the affected side take their syringe in the room with some paper towels and insert into an area and basically snort a little lidocaine, maybe a tiny sting, no flavor to it, but it'll help anesthetize the nose, so when we're inserting our cotton tip applicator, it's with minimal discomfort. Have napkins or paper towels nearby, and could I have an assistant grab me a napkin, please? Thank you. And I would wait 5 minutes or just as long as it takes to assemble this. Thank you. Alcohol less than 0.1%, and I can feel it. So it stings more than my patients let on, and it definitely has cherry flavor, which is not mentioned anywhere in the big part of the label, but I do see it in the ingredients, and you can certainly taste it. Hopefully it will not affect this part of the test. Have a timer nearby, so once the procedure is underway, I like to leave it in for 20 minutes. What? And this gently will twirl down the nasopharynx a fairly long way. And since it's anesthetized, you barely feel it. And sometimes it takes some wiggling to get it past. Having a little bit of difficulty in my nose, which is unusual because you'd think it'd be easier if you could have that tactile feel. Come out and reinsert. Oh, there we go, a little further. I use a gentle twirling on my patients. Hopefully that'll work for me. And you'll be surprised how far it is to the back of the throat. And there we go. That is pretty far in, isn't it? And you can feel it when you swallow. The hard part is visual spatial relations. When affixing the syringe to yourself, I would suggest having a family member do that. And now gently inject 2 cc's. You can feel the lidocaine. It'll drip down the throat a little bit. There we go, and just be gentle with it. feels like a lot more than 2 cc's when it hits your throat. Okay. Start the timer. And go. So I've got 20 minutes on the clock. I've got this properly seated. What's important to be careful is any trauma here will probably induce a nosebleed or some minor damage into the back of the throat. My patients lie flat when doing this. When I perform it, they're lying flat. This is a gateway to the second part, and I was challenged to see if this would present a brain freeze headache or ice cream headache. And in 20 minutes, we're going to find out. In the meantime, we're going to make our mango milkshake, my ice cream headache inducer of choice. I will have 2 assistants who will either have mango milkshake or plain ice cream, and they are going to use pressure with their thumbs on the roof of their mouth as their technique. So we'll see you back in just under 20 minutes. And again, keep a napkin handy. Okay. All right, go ahead and turn that off for now, and we'll come back when we're ready. On the right-hand side, the red button. Other side.
Right here?
No, on the other side. Yeah, the red button, silver and red. That's the one.
It says start, stop?
Yes.